Hello and welcome to Catamount Community Connection, your weekly public affairs program here at Catamount Radio. I'm Brian Collamore. Thank you very much for joining us for our 1-hour program. And we call the show Community Connection because we speak with community leaders from the business, professional, nonprofit, and political arenas. My voice will be a pretty dead giveaway that I'm recovering from a cold, but we want to take some time today to talk to Eric Maguire, and we'll do that in just a second. I want to remind you, our show brought to you by the Rutland County Agricultural Society, which has brought you the Vermont State Fair at Rutland since 1846, and we're looking forward to the 180th Vermont State Fair. I guarantee it'll be a lot warmer back in August than it is this morning or this evening as you listen, but we appreciate the support of the Rutland County Agricultural Society for a long time now on this show. We've done over 100 shows, and they've been with us every single step of the way, so thanks to those folks. And I mentioned we're going to talk to Eric Maguire, who is a member of the House of Representatives. He is a member of the Committee on Human Services, and we are probably going to speak a lot about our unhoused, I guess that's the new term for it, or homeless, as some folks still refer to it. And Eric is, of course, well-versed in that work. He did start, and I'll give him a chance to bring you up to date on his biography. I know he's a Massachusetts native, and the first term, I believe, he sat on a different committee, and then was switched over to the healthcare last time and has been there ever since. So, Eric, welcome in. A pleasure to have you back.
Thank you for having me, Brian. I appreciate it. And
so you are from Hyannis, Mass., right, originally?
Yeah, I was born in Hyannis, grew up in the Boston area, and moved on up to Rutland City about 15 years ago to get closer to my son. And
okay.
Since I've been up here, it's been a great pleasure to serve the community, and I like to think that I've done a good job in doing that.
Well, from what I hear, you have. So, things are a little bit different in Vermont, although maybe politically not that different from Massachusetts on occasion. But certainly the issues that you are working with are a little different than your first committee, which was
Institutions and Corrections.
Right. And so you got a little bit of schooling there and then switched over. This is your second term on healthcare?
Yeah, second term.
Okay.
Oh, excuse me, first term, second.
Second year of the first term.
Yep.
Gotcha. Okay. So as we kind of look at the situation, and we're now in early 2026, obviously, Vermont continues to grapple with a severe homelessness crisis. We are now, from what I understand, the fourth nationally in terms of the high rates of homelessness, which has gone up dramatically since COVID. Emergency housing calls for legislative action to come up with some more money to fund some long-term solutions like affordable housing, better mental health and substance abuse services, and just generally data collection. And I know you are working now with your chair on a current bill that will obviously come through the House first and then make its way into the Senate, unless there are companion bills. So take us through a little bit of what's happened over the past couple years with the homeless population, if you would.
Well, I think it's important to start that we're facing a serious homelessness challenge, and it's about more than just shelters. Right now, our emergency housing system is significantly strained. Shelters and motels are full, and families and individuals are waiting for permanent housing that simply doesn't exist. The root of the problem isn't individual behavior. It's structural. As you mentioned, Brian, there's too few affordable homes, high rents, and long waiting lists for subsidized housing. So just to bring that point back around, it's not individual. We have a significant structural issue, the lack of those affordable units, the increase in rents, and the long wait list right now for the subsidized housing.
Okay. And you have since changed jobs as well, correct?
Yeah, that's correct. I am currently in the position over at Brock, implementing a program first a shelter first, program ready shelter. And what that is an opportunity for individuals that are experiencing homelessness, but are in a better predicament to get moved to the next level, i.e. a more permanent setting. They don't have as many of the high acute mental health illnesses or dealing with high acute substance use. The individual that we see every day that may be residing and sleeping in their car and working full time, but just can't afford what the rental prices are. So we want to provide that opportunity to get them housed into this, and then provide that support necessary to get to the next step.
I know there's a stat that is often used by, the mayor when he is on this program, that there's a certain percentage of people that are experiencing homelessness that also have a substance abuse issue. And I don't know what that is. It seemed like it was a lot of people that were so affected. In other words, a rather small sort of chunk of that group also battles the substance abuse issues. And I've always maintained that one of the things that we did not do back in COVID and when we first began with our general assistance expansion with the hotel motel program, we did not give people the requirement that they take advantage of certain programs that would help them kind of get sober and get off whatever it was that they were doing so that they could again become productive citizens. And, the homeless situation, you mentioned the structural one with just the physical buildings that we would be able to provide these people. But I think we owe it to them as well to provide services. And we didn't do that. And what we wound up doing, unfortunately, seemed to be putting them in situations where they just continued to suffer. And the folks that owned the hotels did not have any interest at all in providing services for these folks. And I hope, certainly as we look to long-term changes, I hope that is part of the solution.
Well, absolutely. And to your point, yes, the state of Vermont's infrastructure continuum of care, whether it's with homelessness, whether it's with mental health, whether it's with substance abuse, is inadequate to an extent. And it's not due to an amount of providers. It's more due to infrastructure. There are significant gaps in service and residential treatment. And to your point, what we ended up doing is, over the past several years, we relied heavily on hotel and motel placements to house people temporarily. While these programs provided that immediate shelter, they had significant limitations. Many of the hotels and motels are not designed for long-term stays. They're not designed to address the underlying issues of substance abuse or mental health, nor should hotel owners be asked to provide those level of services. That's not what it was intended for. Yet, without those on-site supportive services, we ended up isolating people. We warehoused individuals, and over time we stole their agencies to problem solve. And then all of this now, all these unintended consequences have remained in these temporary placements. So the only way, to an extent, out of this is, yes, we got to make quality investments into our continuum of care structure. We do need to establish longer-term permanent and supportive housing. We need to establish longer-term treatment placements for mental illness, longer-term treatment placements for substance use. And once those gaps start to get filled, and it's a gradual build, we're not going to solve this overnight. Rome wasn't built in a day. But let's take a look at the system as it is, see what's working. We know there are aspects within the system that'll work, and I'll take substance abuse. Our recovery centers and our recovery housing are working out very well. But we only have 2 long-term placement facilities, that being Valley Vista and Serenity. Now, Valley Vista just established a longer-term care facility in Virgins, yet we still don't have enough resources to get people into the placements that they need. And it's the same thing within homelessness. It's really one road right now, and that's towards the hotel motel, which are more low barrier establishments. And if we build this continuum to where we establish more like what's being placed over at Brock, which I'm going to be running, where we're looking at a person's situation, seeing what their need is, and then recognizing, are they capable of responding to what we're providing? That sometimes has to do with their learning style. Where are they at? How can they, fit into what's being provided? But everybody's kind of placed down this one road, which has now become so bottlenecked and overburdensome that we don't have the capacity at this time to really, expand these things. I believe that we do, but it's just going to take quality investments. And yes, is it going to cost money to put this stuff in and put these things into place? Yes, it will, but the investments are going to have a greater return in the long run than what we're seeing right now.
Many people have pointed out that Rutland County was, in their view, and you can certainly make a case for it, unfairly burdened with the highest percentage of this situation. And I don't know where we are right now. Are we in good shape? Are there still people that are here from other parts of the country, other parts of the state? How are we doing, I guess, is what I'm asking, because Rutland seemed to be really, really buried deep for a while in just pure numbers.
That's accurate. Where we're at right now is probably still a little bit lower than the levels of last year. I believe that we still have roughly 216 hotel rooms that can be utilized for GA assistance, the motel hotel program. The number currently is right around 150 residing. We don't track whether or not people are from other states and that's coming on up here to get on our initiatives and benefits. I believe we should start tracking that. The thing that's been concerning to me over the last, I'd say about 6 to 8 months, is that the housing reports that are provided by DCF to legislation, and they are publicly available, and I recommend anybody go on to the Human Services Committee website and pull up that report. We are bringing more people into the coordinated entry HMIS system than are exiting. And to take that a step further, more people are returning from stable housing to the homelessness system than are exiting. And we can't get the answer to the why. And the example would be is somebody that was considered in the system of HMIS and coordinated entry and designated as homeless. They got stable housing.
Yeah.
Right. So they were exited from the system. Now they're back. And that rate is right around 50%. So we literally have this recidivism rate of homelessness going on within our state. Now, I have looked at other states in regards to their systems and so forth, and they're showing right around a 10 to 15% return rate. We're upwards around the 50% rate. And I do, tell people to go and look at the numbers for themselves, and I'm right there, right around that 50%. That's concerning. Because if we're able to keep that, we think about this for a minute. If we were able to keep that number housed, talk about a significant cost reduction. So there's a couple of other things that need to come into play here. I think we got to do a better job of investing into retention. Let's invest into these retention services and keep people housed. Let's invest into more preventative services to keep people from going homeless, and then reduce what we're utilizing within the hotel and motels to get them into a system of care that they can be successful in.
We're talking to Eric Maguire, who is on the House Committee on Human Services and represents the Rutland City District. And I wonder how many of those, you say, well, we have a 50% rate of those who had exited the program, unfortunately returning to it, but we really can't put our finger on why. I would think that one of the things that I would be looking at is how many of those folks had the substance abuse or whatever their issue was, treatment programs in place when they exited. Because I think, again, it's one thing to provide stable housing, but if you don't sort of attack the root of the problem, it seems to me like you're only asking for them to return again. So I think that's a key element as to whether or not we're doing a good job getting those numbers down. Are most of those people taking advantage of programs that are being offered that are, trying to get them back on their feet, so to speak?
Whether they are or not really isn't the thing. I think it goes back to we don't have enough also available affordable units.
Okay.
Again, we could probably put as many. We could build all the shelter beds in the world, but the fact of the matter is that's a very expensive solution. That's not really how things should go about. And again, the shelters are not designed for long-term placement. So whether people are actively participating in relevant services to address their substance use and so forth, yes, there's probably a good majority. But once they get done doing that, what's the placement that we have? Back into a GA program or that type of shelter system. Until we get the affordability and those units up and going, you're still going to see, I believe you're still going to see that cycle of return.
And many of these folks, I think, are taking advantage. You mentioned Valley Vista and Serenity House. And then locally, we've got Turning Point, which I find Tracy does a very, very good job there. And hopefully some of these folks are taking advantage of the programs that they can offer so that, again, they're moving in the right direction. Not sure how many of them have received offers for employment. But to me, that would be another clear indication that they're on their way back to not needing the general assistance if possible. So I just wanted to put that out there too.
Yeah, and I appreciate that because I don't know where that data could be extracted. It's a great point. It's something that we should be utilizing and tracking if we do have individuals that are in the data system of the HMIS. We should be tracking whether or not there's progression. But again, the HMIS system is more designed as a crisis response. It's not designed as a retention type system. So when you're working off of a crisis response data system, you're not able to establish other these key points that show progression and show retention and show prevention.
The other
so
thing,
it comes to a point that we might want to look at other mechanisms to implement within that data system that can help us extract key data points to help drive better policy.
Yeah. The other thing that I always felt badly about, because all too often we take a paintbrush and we make a big stroke, and we sort of include a lot of people that may not necessarily be in the same situation. And I'm thinking of single moms with kids, and there are substantial numbers of those folks who don't have substance abuse issues, but they have homeless issues. And unfortunately, they're in the same environment if they're in the hotels and motels with folks that do. And so they're unfairly, I think, categorized that way. And I can't imagine how tough it must be for a mom with a couple of kids watching some of what goes on there. It just, it makes me sad.
It does me also, and you just hit it all right there, the need to make the appropriate investments into a continuum. That way, we're placing people in a situation where they feel safe, stable, they have an opportunity to progress and move forward and come out of these current circumstances. Right now, back to your point, Brian, we have that one access point, and it's turned into what I like to call the crabs in a bucket theory. You ever seen crabs in a bucket?
I have.
One crab tries to get out of the bucket, the rest of the crabs pull it down. And everybody kind of remains in the same system to where the system no longer becomes being in a system, but the system is literally now on you. And getting something off of you is very, very difficult than getting out.
Yeah. And we are now operating, if I'm not mistaken, under the winter rules
Yes.
for general assistance, which are a little bit different. Obviously winters in Vermont are different than summers in Vermont. So it has a little bit more flexibility in terms of the people that are in the program. I'm not sure the exact delineations. It has to do with temperatures getting to a certain point and all that kind of stuff. And I don't know about dates. It seems like in April things change. Am I way off here?
Yeah, it's in April. What's called the cold weather emergency response ends in right around April. Yes.
Okay. And again, we're talking with Eric Maguire, who is on the House Committee on Healthcare or Human Services. We call it Healthcare in the Senate, Human Services in the House. And we're going to take our first break here on Catamount Community Connection. Again, I apologize. Still getting over a cold, folks, but you can't catch it. It's not contagious over the airwaves. But there were some rough moments in that first week of the session last week, and back on the mend, I guess is the way we put it. So we'll be back with more of Eric Maguire here on Catamount Community Connection in just a minute. Welcome back to Catamount Community Connection, our weekly public affairs program here at Catamount Radio, brought to you by the Rutland County Agricultural Society, which has brought you the Vermont State Fair at Rutland since 1846. And it may seem like a long way away, folks, but the 180th Vermont State Fair is only months away in August of 2026. I'm Brian Collamore, your weekly host, and Eric Maguire is with us today. Eric sits on the House Committee on Human Services, and we've been talking about some of the issues that have surfaced with regard to our homeless population, ways that we at one point felt was adequate to address the issue. And I'm talking about the hotel-motel program because that got the most press for sure. And our numbers in Rutland County greatly inflated, especially during COVID and immediately thereafter. And I think Eric's got his finger on a pretty good solution, and I want to let him talk about that a little bit. If you look up H594, that is the House bill that Eric and his chair, Teresa Wood, have introduced in this session. In fact, it was introduced in early January, and it is going to go to the committee. Probably by the time you hear this, it will actually have already been gone, or it would have already been received by the committee. And Eric is going to outline that for the whole committee. But I thought it might be appropriate for him to tell us a little bit about what H594 does. And, you got bipartisan support there, and that's very important in terms of getting something done.
Yes, and let me start with expressing my gratitude and appreciation to Chair Teresa Wood for reviewing it and the willingness that she wanted to work together bipartisan, because as I've expressed on numerous occasions, and I believe this is for any matter or policy that we are working on within legislation, there has to be bipartisan collaboration. We have to get together and understand there are going to be ideologies that we agree to disagree on, but I believe that we can all come to a conclusion of what we do agree upon. And I know that we all agree upon that the hotel-motel program is not working. So more or less, the bill establishes two temporary programs for fiscal years 27 and 28. The Temporary Emergency Housing and Accountability Program and the Return Home Program. Together, these programs are intended to replace Vermont's current open-ended general assistance emergency housing system with a more structured, time-limited, and accountability framework that prioritizes the most vulnerable Vermonters while transitioning the state away from the long-term reliance on hotels and motels. Really, what another concept behind this bill is we got to get the system stabilized. We got to stabilize the system. Let's get the infrastructure and the capacity in place to stabilize the system, and then we are able to move forward in a more long-term vision. So that's kind of why this needs to be sunsetted. with these mechanisms in place, it allow us to take a look at what's effectively working. Did we get the mechanisms in place to stabilize and get it structurally feasible, and then move forward on what I like to say is this bill is a bridge to H91. And with that bridge, like H91 was more designed as that long-term investment into the homelessness continuum of care. We needed a bridge first, because you can't build a system if you don't have the infrastructure and capacity in place, whereas 594 puts that infrastructure and capacity into place and bridges its way to H91. So by embedding strong oversight, time limits, case management, and performance reporting, this bill has the potential of creating a stable foundation for systematic change. Yet at the same time, this bill is highly amenable, meaning it's a great framework to work off of. We can take pieces that are working with other systems, implement it in there, and we can drive the policy bipartisanly that's going to have a very effective and impact on what we already have in place. And the thing is that we got to stop pretending we can have compassion without accountability. Now, again, programs that establish, accountability and all of these other mechanisms are still not going to solve the homeless problem. We still need those affordable units. And I don't mean to keep coming back to that, but I believe it's vitally important that we recognize this is not a permanent system of care. No shelter system should be used as your permanent system of housing. Why? Because you always will hit a stagnant point to where you can't go any further. So other pieces that are in this is central to this program is the tier continuum of care that organizes housing placements by level of structure and support, meaning that your example of that single mother of two kids,
right?
Instead of just having direct access to the hotel room, now there's going to be levels of services available of supportive temporary family units. We are in the process, and I know Mary Cohen with Cornerstone has been working on this endeavor in purchasing of the Loretto home, which ultimately would be, one side of it would be temporary supportive family units, and the other side would be permanent supportive family units. That's where that family would go to that location, because that's where that fits their needs. Exactly. And helps with their thing to be moved to the next step. So having a continuum of care organizes housing placements. Yes, high barrier shelters are more identified as the preferred initial placement, only if capacity, staffing, and geographical accessibility exist. And these shelters require structure, rules, mandated participation, and relevant services. Why? We want to assist and support in getting them into that better position to succeed. Low barrier shelters are structured as that, okay, we got to get your placement there because it's a crisis, we get you housed, and then we need to then move you to the next step. We're limited in that capacity at this time. This bill helps to build those levels of support and capacity. The Return Home program is mainly not just identifying if somebody is maybe from out of state and, listen, I have family that will help on out, I just need help getting on back there. Yes, that is one premise behind it. But the second premise is also to locally. Maybe there is an individual that's out in Brattleboro and they just don't have the ability to get back to their family, maybe in St. Albans. Or there might be some other initiative that they may need to help get stabilized back with their family. This Return to Home program provides some funding to move them, to keep them out of the system and get them back to their family. Who doesn't want family unification? So there's a lot of key points within here, but there's also many things that do need to get amended within the bill. And I want to make sure that the bill is not recognized as a permanent. So more or less, nothing in the act shall be construed to replace or preclude the development or implementation of evidence-based permanent housing solutions or long-term housing stability approaches. That's not. This bill has to make sure it's a temporary, it sunsets, and it makes quality investments into our continuum of care that will push people into a better position to succeed than what's currently in place, in which we are literally removing people's agency to problem solve by warehousing them in a situation. Do I mean that the providers within the county, they're doing a spectacular job. They're doing the best they can with the resources that they have, but their resources are limited. Their infrastructure is limited. So let's help build these agencies up to where we can really disseminate the services most effectively, transparently, and in a manner that we're going to see the results that we've been asking for.
We're talking to Eric Maguire, a member of the House of Representatives in the General Assembly, and he sits on the Human Services Committee in the House. I did kind of cheat and look ahead, Eric, because one of the first questions someone's probably going to ask you about Bill H-594, how much is it going to cost? And so from what I'm reading, this bill would ask for $30 million in fiscal year 27 and $25 million in fiscal year 28, so a total of $55 million. You can tell me whether that is right or wrong. I mean, it's on the page here because I've got the bill open. The other thing that I will mention, especially in this year, and I have no idea what's going to happen next year, we've got an election coming up in November. And then we've got, new people coming into both the House and Senate, maybe in the administration as well. And so I don't know what sort of funding might be available next year, but I can tell you this year is going to be very, very difficult to appropriate money for a new program unless we can somehow take part of what now is in the GA fund and move that over. That would just be one of my immediate questions, whether we could do that. You've got the whole education reform piece looking at this directly, and we've already talked about 75 to 78 million being able to be used of general fund to buy the property tax rate down. So if we do that, there isn't going to be a lot of money left over, I guess is what I'm saying. So do I have the numbers right, first of all?
I'd say the numbers are right in that targeted area, but does this reduce cost? In the short term, the bill does. It allocates significant funds, $30 million in FY27 and $25 million in FY28. But these dollars are targeted toward building capacity in permanent housing, which lowers reliance on high-cost motels over time compared to the current system, where motel spending can exceed $8 to $10 million annually without even creating any new units. This approach is more cost-effective in the long run. The bill's structure incentivizes throughout to permanent housing, reducing repeat episodes of homelessness and associated emergency costs. So in essence, the bill aligns with Vermont's fiscal and policy goals. Spend smarter, not just more. So that's literally what we're looking to do is let's spend smarter, not more.
So I want to give you credit because I know that this is something you worked on all summer, this past summer, and you did get your chair, Teresa Wood, who is from the other party, to co-sponsor this with you, which I think is very important to get that bipartisan support. But you were the person that put most of this together, along with Legislative Counsel. So I'm looking at basically, I think it's a 30-page bill, and we have only hit the high spots in it. As is true with most legislative work, this will be introduced or was introduced in early January and referred to the House Committee on Human Services. And so the committee, I think there's 11 of you on that committee, is that right?
That's correct, yeah.
Yeah. you'll begin to open it up and look through it and take suggestions maybe for changes to that. Very, very rarely is a bill ever introduced in the General Assembly in Vermont that finds its way all the way to the finish line with no changes. So that said, we know that there'll be changes to this. And then that doesn't do anything about when it gets over to the Senate side, because the Senate Health and Welfare Committee will do the same process. They'll take a look at what you came up with on the House side, what passed on your floor, and then begin to take testimony in different directions about what they think we should do. But I do think it's important that you get credit and recognition for, tackling a really tough issue. It's not a single phase issue. There are so many different things that have to do with this. And thankfully, you got some support from your chair, which probably means it'll get out of the committee at least. And then, when it gets to the House floor, it could also get changed at that point too, right?
Oh, absolutely. And again, if it's a great framework to work off of, and I believe if the main concepts of the bill remain intact, it's got the potential, as I said, to spend smarter, not just more, and it remains a bridge, not a destination on the path to affordable permanent homes. That's two of the key points that really need to remain in place. It's a bridge, and let's get people on the path to the permanent homes. If we utilize there was some outstanding concepts within H91, and I believe if we take some of those and integrate it with these concepts, we have a great policy to put on out. And there's other mechanisms in there too. The reporting. Let's capture the correct data that's going to drive the next policy into place, where we're going to go into the future, not just rely on, superficial data that's really not explaining the whys on retention or the whys in prevention. And there's also very strong guardrails in fraud prevention. We know what's going on nationwide. And I believe it's something that we got to keep into place. This bill holds 3 levels of accountability: the state, the provider, and the participant. I operate a shelter. I want to be held at the same accountability as the participant. And I believe in this path of operating and practicing the HARD. And I use HARD as an acronym: honesty and humility, accountability for the A, responsibility and discretion and discernment within your decisions. Now you think about that, Brian. You practice that each day. That's a hard day, mentally, emotionally. Or you can practice the easy. You can make excuses, provide assumptions, be self-serving, and then you yonder away. You think about that for a minute. That's a pretty easy day. So let's stop making excuses, stop making assumptions, stop being self-serving, stop yandering away from our colleagues, and then get on that road of practicing the HARD. Let's use these discretion and discernments. We may not always agree, but I believe we can agree on that premise of practicing the HARD. When we use accountability and we use rights, with rights come responsibilities. With accountability comes responsibility. With accountability comes discernment and discretion. And you know what also comes with all of that, Brian? Compassion.
Yeah. Well, you've hit, as I mentioned earlier, one of the main issues that most people I talked to had about the way we were running the hotel motel program. First of all, I feel we should be finding out where these folks are from. If they're fellow Vermonters, to me, that puts a whole different light on it. And I know a lot of people did come down from further north in the state of Vermont, because we have the capacity with the hotels here to take care of folks. But I think that is important to find out what that sort of split is, how many are Vermonters and how many are from other places. Not that that's a bad thing if you're from out of place, but maybe somebody else should be kind of looking at you in terms of trying to help you. But then the other thing was the accountability issue. And we had nothing in place that would have required people to take advantage of programs. So from what you're telling me with your accountability issue in this bill, you are addressing that.
Absolutely, and also within there are mechanisms of verification in regards to residency, and that's something you got to tread very very lightly on. For instance, within my first draft of the bill, I looked at having a resident requirement of you had to be a minimum of a resident in Vermont for 12 months. Fortunately, that is constitutionally no-go. There was a decision made by the Vermont Superior Supreme Court many years ago that you really can't set a time limit. But what you can do is put other verification mechanisms in there, whether it's an ID, a state ID, and other things that can be assured that we are doing the best we can to serve Vermonters. I don't know whether or not the HMIS system is a national system.
Tell us what the HMIS stands for.
The Homeless Management. I don't know what the I stands for. And I don't know what the S stands for.
I assume system, but maybe not.
Homeless. Anyhow, it is. Each state uses one of three contractors for this system.
Okay.
And then the states can decide what mechanisms they want with their data collection and so forth. But knowing that it'd be interesting to know, and I don't believe it's the capability is that those states don't really talk to one another in regards to who's in their system. Therefore, do we know if somebody may be in the Idaho HMIS system from July to January, and then next they're in the Vermont HM. So we don't know that. We're always pointing out that I would put a percentage of about 20 to 25% are not residents of Vermont, and you can also look at that data that's provided by DCF on the housing reports, because it's still perplexing to me that the state is also averaging, I'd have to go and look, but roughly 50 new individuals entering into the HMIS system.
50 every week, month, year?
No, it's roughly 50 a month.
Okay.
I'd have to go back and look at each one of those. And again, you can verify this through those reports. Where are the 50 new coming from, number one, or what's the why and things like that? It's and what's also interesting is the numbers are a little bit higher at our bordering counties. So, I think we got to get back in the practice of being, the things that I've seen kind of dive down is like use some critical thinking skills.
Yeah, a little more data driven maybe too.
Yeah.
I assume some of this money is federal that gets to us from Medicaid and programs like that. And, of course, that adds another complication to the funding issue, because for a while we were able to sort of predict what we were going to receive from federal dollars. It may not always have been to the exact dollar, but at least we had an idea. That does not seem to be the case anymore. And so that would leave a hole. If we get fewer dollars from the federal government, it means that either we don't do the same thing for Vermonters, or we got to find a way to pay for it that the federal government has decided not to. And that complicates it too, I would expect.
It complicated it back in 2022 when we made the decision to expand a federally driven program on the state dime. That was a dangerous decision, and we are now feeling the repercussions and those unintended consequences of that decision. So, yeah, that is a significant conundrum that needs to be solved. Unfortunately, we're not going to be able to. I'm just going to go out and say it. It's nearly impossible to be able to replace, if we have 3,000, roughly 4,000 individuals, family units that are in a homeless situation to be able to provide bed for that. That's nearly impossible. We don't have the infrastructure or the capacity to make that happen. What we do have is the ability to drive a policy that can make things better.
We're talking to Eric Maguire, a member of the House of Representatives here in Vermont, and he is a member of the House Committee on Human Services, and we're talking specifically now about H594, which is Eric's bill that was co-sponsored by the chair of the committee, Teresa Wood. And we're going to take our second break here on Catamount Community Connection, and we'll be back with Eric for our final 9 minutes or so in just a minute. Welcome back to Catamount Community Connection, a weekly public affairs program here at Catamount Radio. I'm Brian Collamore, and today we're talking to Eric Maguire, a House Committee member on Human Services. And we talked, for the whole hour pretty much on homelessness and ways in which Vermont can begin to solve the problem. It is a many-headed problem, and his bill, H594, and I'd urge folks to look it up on the legislative website if they choose to, goes a long way, I think, in at least thinking about different ways in which we can do this. You know, we look back on the past few years where literally we were just throwing money at the hotel-motel program, and it became obvious, I think, even to those who really did support it, that it wasn't working. And there was no way it could without, again, some accountability and sort of some long-term thinking about, wait a minute, is this going to be our permanent way to solve the issue? There's got to be a better way. So take a look at the bill and let people know how you feel. We are all on the legislative website with our phone numbers, even though a lot of people use the Montpelier number. I have my landline number up on it. In case you want to know, it's 773-1365, and you can feel free to call me. I do still have an answering machine, and when I get back, because I do live up there during the week, but when I get back on Friday evenings, I listen to my messages and begin calling people back. But all the information there is on the website. If you feel that this has got some merit and you'd like to see it passed, please let people know. If you think it's the worst idea you've ever heard, you should let people know that too. And maybe somewhere in the middle, we'll find a solution to this. But again, I want to thank Eric for taking the initiative, because this is a problem that a lot of people don't even want to get next to. We have focused certainly early on in the session with the educational reform piece, and it's got a connection with this, certainly with the funding issue, if nothing else. And I don't know whether this is going to take all session to iron out, or whether you could make crossover by town meeting week and then get it over to the Senate side and have them begin to work on it or not. But it's an interesting bill for sure. And you know by now, because you're beginning to learn the ropes pretty well, how to get things done in the State House in Montpelier, I think. Do you feel confident about that, or?
You know, I feel very confident in regards to taking that step and just to put it out there. You know, let's have the discussion. Let's talk about it. Let's talk about it reasonably and with discourse and respect and with dignity. Let's utilize our critical thinking skills. Let's accept constructive criticism in regards to things that may need to be looked at, but you do it in a manner that expresses opportunity. And I don't believe in trying anything. Trying to me leaves the most readily available option, and that's failure. But I also believe in learning from failures. So if we can at least take a moment and to recognize the systematic failure of the hotel program and see what we can do better and be better at, I'm good.
Okay.
And whatever the outcome is, it's better than what we have now. And I don't think anybody would debate that. So
how about other issues that are going to come before your committee in the House? The the Human Services Committee. In the Senate, again, we call it Health and Welfare, and that, of course, has to do with the cost of health care, which is exploding. It seems by double-digit percentages every single year. There's got to be a way to tap that down somehow, but I don't know if there are any other issues in your committee that are coming up that we could talk probably about 4 minutes about.
Well, I think recently we just took some testimony in regards, and we'll be providing our recommendations to appropriations and any BAA, Budget Adjustment Act matters. It seems like the direction is going to be focusing on what we can do in regards to H94, in regards to putting together a more practical and a practical and applicable GA housing, whatever people want to call it. I believe that's going to come to now the main focus of the committee.
Okay. I know Senator Lyons' committee on the other side has taken a look at, hospital costs, insurance, all that kind of stuff, and tried to get some information for that committee to figure out what we could do to begin to turn the curve on the exploding cost of health care. And that has to do with, state workers who have health care are faced every year, it seems like, with, as I say, almost a double-digit inflation in terms of what it costs to keep them healthy. And there's got to be a way to fix that. I don't know what it is, but there's got to be a way. Yeah,
and I'm open to any suggestions in regards to that. I'm going to sit here and say I'm an astute expert in the healthcare costs and that matter. I do know that we have spoken very in-depthly, and we do recognize the more needed investments into elderly care, nursing home care, and those other elements. Because it is compelling to me when you do look at those housing reports. Currently, we have roughly 250 nursing home beds available. Why aren't they being utilized? And again, it could be a multitude of factors, whether it's staffing, whether it's infrastructure, whatever regulations are, people don't fit in those beds, but 250 beds. And if we're recognizing that roughly over, 1,000 elderly Vermonters are considered homeless, where's the disconnect there?
Yeah.
So I know our committee is looking into, supporting and building up that infrastructure too.
I did put a couple bills in on behalf of the Rutland Regional Medical Center. One of them has to do with the treatment of folks who are involuntarily in the situation in the hospital, and for their own safety and the safety of others, there was at least some thought about being able to treat them at the moment with very, very strict guardrails. Without their consent. And that bill I did put in, and I think it was Jim Harrison before he retired. He also put one in on the House side, and I think Bill Canfield from Fairhaven wound up being the sponsor, but they're exactly the same on both sides. And then the other one was the so-called antitrust provision, where we have 14 hospitals in the state, and right now there are problems with them getting together to sort of figure out ways that they may purchase products or services as a group and save money. Right now they can't do that. They sort of have to individually go out and look for the best prices. So this would allow them to do that. And again, it seemed like a really good idea to me. I don't know how far it'll go, but it'll be in your committee at one point or another, I think. Both of those will.
Yeah, and they're both excellent bills. The first one you just mentioned, that is a result of our lack of infrastructure and capacity. We don't have any forensics units within the state. Our high acute mental health system. Therefore, it puts health workers in those positions, in very precarious positions, and waiting for the judge to provide a ruling in regards to whether or not you can administer that level of service or not. I think it all comes to the point that we got to really take a good hard look and get into the practices of providing the level of care that is necessary for the people that need that level of care, and instead of placing them into an environment in which the scope of practice is not available. And when you operate outside of your scope of practice, you put the individual that you're serving as well as your own agency at a precarious and potential risk.
Yeah, we found that the emergency departments in all of our hospitals are unfortunately the sites for a lot of violent behavior by people coming in off the street. And the more that those services are utilized, they can only take in so many people in a given shift. The more likely it is that some of those people will turn violent, and then we've got issues with people that work in the hospital. So we've worked pretty closely and carefully, I think, to come up with ways that, you've got security people on duty now in most of the EDs, and it's not as bad as it was, but it certainly can get a lot better for sure.
Absolutely.
I know I wouldn't want to be working in a situation where I've got to continually look over my shoulder for somebody coming at me. But yeah. Okay, well, Eric, it's been a pleasure. I really do appreciate you coming in and talking about the issues that we've talked about. Eric, again, Maguire from the city of Rutland. He's in the Rutland 5 district and sits on the House Committee on Human Services and has a bill in H594, which addresses a lot of the issues that we have talked about here for the last hour or so. Love to have you come back at some point, hopefully with the good news that your bill did get traction and was taken up by both the committee and the House and then sent over to the Senate. I guess time will tell on that. And again, thank you very much for coming in today, and look forward to seeing you again.
Absolutely. I appreciate your time, Brian. Thank you so much. And thank you for all you do for Rutland County as our senator. Your impact has been significant, and you continue to fight for this county, and you continue to do what's right for this county. And we all greatly, greatly appreciate it.
Well, I appreciate those words for sure. Okay, folks, that'll do it for this week. We'll see all of you next week on Catamount Community Connection.